Welcome to Generation Nurse. This video is going to teach you how to use the Neonatal Abstinence Score tool, otherwise known as the NAS tool, as you'll see in the textbooks. So what is neonatal abstinence? This is when a neonate is unfortunately withdrawing from a substance. And why does this happen to babies? Well, sometimes when the baby is developing in utero, mom may be using a substance, either prescriptive or non-prescriptive, that once the baby is born, cuts them completely off of it, and then they experience symptoms of withdrawal. Some of the examples of substances that they can be exposed to are opiates, different types of street drugs, prescription drugs like oxycodone, morphine, Suboxone, and methadone, tobacco and alcohol. And so usually we'll see an onset of symptoms for this somewhere between 24 hours of life and even up to as long as a week. So we have to know what these symptoms look like, and we'll utilize a tool to help us give the baby a score to decide whether or not they need some sort of withdrawing medication for their safety. So when we use this tool, we're going to calculate all of the symptoms, and it's going to give us a score. If the score is greater than 8, we typically will assess the baby every 2 hours, because we're going to be giving them some sort of medication, such as methadone or Ativan. Some doctors will even use low-dose morphine in order to help the baby to wean off of whatever drug that they were exposed to. If the scores are less than 8 and the symptoms are mild, we'll use some non-pharmacological treatment options such as snuggling, swaddling, pacifiers. Breastfeeding can be a great tool. And so it really just depends on what the baby needs, and that tool that we're going to learn today is going to help us with that. So part 1 of the tool is central nervous system disturbances. This talks about the baby's crying, sleep habits, their Moro reflex, which is like the newborn startle, tremors, all the way up to convulsions. And depending on the degree of severity, the baby's going to get a higher score versus a lower score if they have milder symptoms. Part 2 is the metabolic vasomotor respiratory disturbances. So these infants, because they're highly agitated, can experience hyperthermia, frequent yawning, mottling, which is kind of a skin condition where their skin kind of looks sponge painted a little, nasal stuffiness, sneezing, nasal flaring, and of course tachypnea, or increased respiratory rate greater than 60. Again, if the symptoms are more aggressive, we're going to give a higher score, and if they are mild, they're going to get a lower score. Part 3 of the tool talks about gastrointestinal disturbances. This is unfortunately part of the baby's big irritability. They have excessive sucking. Because of this, it's very easy to want to overfeed them. But remember the normal amount of volume that a newborn is supposed to receive. If they have poor coordination and they can't eat, they're going to get a higher score. But if you overfeed them and they have regurgitation, projectile vomiting, they're also going to get scores for that. Loose and watery stools are also going to give them increased scores. So when you add all of these up, that's how you find out if your baby is below or over a score of 8, and whether or not your physician or the baby's physician is going to choose a treatment option. Some helpful tips for your test questions is to make sure that you assess these babies with your eyes first. You're going to want to count their respiratory rate, and you're going to want to look at them and see if they have undisturbed tremors before you open them up from their swaddle and start changing their diaper and taking their temperature, because those symptoms will of course increase or be different based off of the child's irritability as you handle them. I hope that these tips were helpful. If they were, please like and subscribe to my channel, and more videos to come. Thank you.